Surgeons/doctors of Reddit. What's the dumbest thing patients have lied about? Part of my job is dealing with medical records. My favorite part is when you're reading the doctor's notes, and you can tell they're fed up with the patient's bullcrap from their tone. Patient in for routine colonoscopy. Asked if solids consumed in 24 hours prior. Patient confirms no. In process of procedure, several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand, as this happened prior visit. Come on, man. Do you think you're like pranking your doctors or something? Why would you lie to them? If you screwed up, just say yes. Do you want to be mid-colonoscopy and for them to realize we can't actually go any further? That seems like a bad time because then you have to do it again. Story 2. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union, meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den, I know they smoke, but they'll tell me they don't right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly, surprised Pikachu face. Edit. Lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. Story 3. Dong modification. The case was an elective above-the-waist surgery, and he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his dong and it was split/bifurcated with multiple piercings to look like a cobra. The nurse didn't know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case. Called urology consult for infection/abscess evaluation. Story 4. I was an emerg nurse for 9 years, and some guy told us this happened when he came in by ambulance at 2 a.m. Says he was making a salad and his cucumber fell on the floor and he slipped and fell on it. Like, yeah, my guy. 2 a.m. you decide to make a salad butt naked, and your magical anti-physics cucumber happened to perfectly torpedo up your rectum because you're a poor godless bastard. Part of me gets it. The other part is like, be honest with your doctors. Because what, are they gonna shame you for how it happened? Refuse to help you? Like, they already know, man. But if for whatever reason the patient doesn't want to save face or whatever, I respect the doctors who just let it slide. Like, whatever, man, we both know why you're here. Story 5. 1. Patient says to me, I was gardening outside while naked and I slipped. That's how a massive potato ended up in my butt. Anybody want fries while he's waiting for it to get removed? 2. How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there, then walked into it. 3. Have you had anything to eat or drink today prior to your surgery? Nope, with a half-eaten candy bar in front of them. Are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Then yes I have. I had half that candy bar. 4. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in, who wouldn't be wise to his tricks. 5. One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Didn't budge. We were talking amongst ourselves about intubating him. Then he opened his eyes and said, "They did that last time. I didn't like it." Story 6. Not considering the psychiatric and the boring answers, there's not much really. Only one really unique one comes to mind. It was a patient who was a really kind old man who would always talk with us a lot, telling us stories, praising the beauty of everyone in a tender and respectable way, saying how really grateful for our work he was, and so on. Said old man would always appear with really high blood pressure values, even though he would swear that he would always use his medication correctly. And after we did so many changes with his medication in many different ways, it's only natural to think there's some problem with how he's taking them, if he was doing so at all. However, one day after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later, we also obviously discovered that he indeed would not take his medication correctly as well, in order to obtain this result again and again. Turns out he suffered a lot from loneliness, and he was an old man who didn't have much contact with his family anymore, but mostly because his family didn't reach out to him at almost any given time, even though everyone lived close by. and in his desperation, sustaining dangerous high blood pressure was the best way he had to obtain human contact within the emergency every week. This was the most odd one, but it's really common in general among elderly patients to appear lying about their symptoms, only for them to be trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better, although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness brings to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is hell of both a simple and complex problem, and one that no one should be bound to live with. I didn't expect this thread to get so sad, but I get it. Humans by nature are very social creatures. If ever there's a situation where people can't be social, this could easily be seen as a way out or a way to get that interaction. I don't know what that man's up to now, obviously, but whatever it is, I hope he's found a few friends or something, although I understand it's not easy at all in old age. Story 7. Their age. Had a woman who says she's 30 when she clearly didn't look it. Oh well, I move on to other questions. Look at her files and lab reports, have her real age on them at 41. Like, why? What difference does it make lying to healthcare staff? This is health related, not your Tinder profile. Nobody's gonna see this and go, I ain't dating an old lady. By the way, she was married with children. Story 8. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave the report to the MD, and when I walked back in with the doctor, she looked at me and said, I didn't think you'd be coming back in the room, and then proceeded to confess she'd been cheating on her husband and thought she had herpes. She didn't. Story 9. It's not so much a patient lie as it is me being dumb. I was inexperienced and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran, and I was admitting him for rectal bleeding. He was in the age where it was more likely than colon cancer, so I didn't think it was necessary to ask for an intimate history. Folks at this particular establishment were known at times to be homophobic, and I'd been yelled at by patients previously for asking, do you bang with men, women, or both? It ate away at my conscience, though, so I went back and absurdly nervously and asked him. He answered, Son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights, but I wasn't sure how it would go over to admit it. That's when the bleeding started. It was a very important lesson for me. Story 10. Woman comes in to emerge with complaints of discharge and discomfort. Pelvic exam initially reveals significant yeast infection, but there appears to be a foreign body in there. Is something stuck inside? No, I don't know what's in there. Speculum examination reveals a very soft mandarin orange. Peel still on. Oh, that. We heard it would improve our fertility. You can't make this crap up. I'm concerned about the usage of the word we here. That means this woman is not the only one. There's a whole cult of women with oranges up there. Anyway, moving on. Story 11. One of my favorite things I wrote my first year out of medical school. Please note, patient has stated multiple times that he wants to leave and would leave AMA against medical device. He asked multiple times whether he could eat, and stating he's hungry. Explained to patient that we would like to start a full liquid diet, and if he tolerated it well, would transition to regular foods. However, instead, patient ordered Chinese delivery. Then patient was complaining of a headache. Was given Tylenol for the headache. Patient stated it didn't help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told to not give the patient goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Story 12. One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse. Patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they're feeling weird. Then this weird feeling turns into intense pain, and he asks for intravenous narcotics. Dilaudid. I tell him no because this story makes no sense. By God, it was a miracle when this man walked himself right out of the hospital after I refused giving him the narcotics. Also, the MRI was normal. Story 13. My little brother was a nurse for about a decade. He said many times that people stick anything up their butts, from light bulbs to hairbrushes to a golf shoe. And at first, it's hilarious. Then after a year or so, it's not funny, because you've seen way too many. Then after a decade or so, it starts to get funny again because you think you've seen everything. And then one day, a 45-year-old man is driven to hospital by his wife, and he has a golf shoe up his butt, and he told his wife that he and the boys were golfing and he slipped in the locker room. It got rammed up there, completely disregarding the fact that the part of the shoe that's inside of him is covered in Vaseline. Story 14. Nurse here. The absolute dumbest thing patients have said, and to be fair, this was the patient's parents since I was in petty but still dumb as hell and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby and called the next one in by last name. They stand up and mom and dad bring the little girl back. I'm rooming them, take the vitals, review purpose of visit, make some adjustments to the chart, update their pharmacy and allergies, and go out and let the pediatrician know they're ready. The pediatrician goes into the room and comes out 3 minutes later and says, "That's not my patient. Where's my patient?" I'm like, what the hell? I go in and ask the parents, and no, in fact, they weren't the patient. So I'm like, why did you say you were someone you weren't? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no HIPAA violations, which fortunately there weren't. I'm fascinated that people can collectively think, yeah, let's do this. No one will know. Like, how does that even play out in their minds? Story 15. First baby, never pregnant before. New OB appointment, we collect everything and do exam. I put a speculum in and I see her cervix. After her partner left the room, I ask her again, and she says she doesn't want her new partner to know she's a single mom. Not dumb, but just very obvious on an exam that she has given birth before. I left a note on her chart to not mention prior pregnancy in front of her new partner. Another, on my general surgery rotation as a med student, removing objects from rectums due to unfortunate, quote, falls. So, you've dated this person long enough to be pregnant with their child, but you don't want them to know that you're a single mom? Where's the kid? How does this work? I have questions. Story 16. I had a patient who lied about having a job. I asked because he had hepatitis A and I wanted to know if he needed medical leave. He denied it even though I asked twice. The next day he came back because he was going to get fired if he didn't provide a doctor's note. Edit for clarifications. I'm in Venezuela. He wouldn't have had to pay anything for that visit regardless of his employment status. He isn't an undocumented immigrant. It's a very small community where everyone knows each other, and he's lived there his whole life, and many of his relatives have also been my patients. Also, undocumented immigrants aren't really a thing here. Some tourists may come without having the proper paperwork, but this isn't really a desirable place for immigrants looking for work. 3. He said that he didn't have a job. He didn't say that he didn't need a medical. I asked what he did for work on his second visit, but I can't remember. There really isn't a whole lot of stigma around Hep A around here, even if you work handling food. People just sort of feel sorry for the person and tell them not to eat yellow things. So I don't think it was because he was afraid of being shamed or reprimanded because of it. I'm obligated to report viral hepatitis cases to the health ministry, so they make sure there isn't an outbreak. And I told him this, so he knew that it was going to be reported either way. Story 17. Resident doctor here. This happened during my psychiatry rotation in med school. I wouldn't say it was a, quote, dumb lie, since the patient was mentally ill, but I would say it's the most memorable. There was a patient at an inpatient psychiatric facility for ideation. She constantly insisted she had a mass on her breasts, and demanded to be physically examined by only male doctors. When the psychiatrist I was rotating under declined to perform a medical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that only found normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature, and would usually focus on intimate complaints when she visited male offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had a lot of issues. But we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her, why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her, quote, health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Story 18. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER with a towel over his groin covered in blood. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses he was trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to help save him, but it cost a hell of a lot more than $200 for emergency surgery. Story 19. I'm just a med student, but a doctor shared this with us. She's a gynecologist, and this woman came to her complaining about how she hadn't gotten her periods in a few months, and, well, she was showing menopausal symptoms. And in fact, she looked almost 50, but she kept saying she's only 30 and can't have menopause. It has a funny ending when the doctor asked if the woman had a kid, and she said, yes, he's 27. I don't know why people lie about their age, but this was a funny story for the whole class. Story 20. The worst I've heard was from the ED. Common question before shooting an x-ray is, how did it happen? Because I may have to use an optional position or something. From women, they tend to say that they tripped on the rug or dropped a heavy box on the hand or foot, or it was dark and they didn't see the door was open. There's always a social worker in the ED and we would take her to imaging for, quote, better shots. Sometimes radiologists would order a SNAT series, suspected non-accidental trauma. Where there's one break, there's always a history of more. Story 21. Not a doctor, but inpatient care nonetheless. 1. Guy comes in between 17 19 years old for, quote, pebble hits dong. Pretty odd. He says he was doing yard work when the tool knocked a pebble into his dong. He went to check it and now it was making pus. Nurse clarified that he was wearing pants. Denies intimate history. He stands by that he got hit on his dong by a rock through his pants that made him produce pus. He had chlamydia. 2. Guy says he was forced to do ice or something similar at a store. Came in because he thought he was dying. 3. A fun bonus. A frequent flyer comes in for, quote, his stomach hurting from his chili he had, while continuing to eat said chili in the lobby. Story 22. Anything, to be honest. I honestly don't care what you do or don't do. Usually if I'm asking, it's because it matters for your health care. And if you lie about it, all you're doing is putting yourself in danger. As a more real example, I've had a post-transition transgender patient lie about the sex they were born with. I understand it's hard to deal with a lot of the medical community that can be judgmental, but this patient ended up having prostate cancer, only found out after we scanned them. Another one lied about having prior back surgery before I was about to send them for an MRI. Did a physical exam and saw the scar. Asked it again and they said, didn't think it was important, and didn't want me to assume it was related to previous surgery. They were there for back and abdominal pain. Story 23. Medical school student. Not a big deal, but a patient lied to me about what she had eaten. She was obviously having some problem with her gallbladder. Typically, this pain can be caused by greasy food. So I asked the patient what she had eaten before she got this pain. Patient said she only ate a salad with very little ranch. That's it. I even explained how greasy food can cause this pain, but she's adamant. She only ate a salad. Anyway, I report back to my attending and we see her together. The attending asked her what she ate. The patient said salad and then adds she also ate a burger. It wouldn't have changed the plan, but why lie? Story 24. I recently had a patient double down to the point of yelling that I never told her to stop her aspirin for a lung biopsy. During our clinic visit, she told me she didn't think she took it anymore, but I reiterated it multiple times, including asking her to check if she took a brand name and wrote it in my clinic note in 2 separate places, saying we'd discussed it. Sure enough, she arrives and says, yes, she takes it, and no one told her to hold it for 5 days. Yes, ma'am, we did. Well, it's Monday. Our clinic appointment was Friday. How would that make any sense that you told me? Ma'am, the appointment was last Wednesday. Oh, I just don't remember. Just open with that, and we'll reschedule you. It's fine. Story 25. Not a doctor yet, but soon to be. It's not uncommon for patients to lie about drug use/abuse. I am a former addict. I will know, be sure of that. Please don't do this. It's one of the most important things for us to know. And you won't, at least shouldn't, be reported/frowned upon or whatever. Edit. People, the world is not solely the United States. I feel sorry for the atrocity of a health system you guys got there, and no human being should ever be red flagged for such a thing. What the hell, America? Story 26. Not a surgeon or doctor, but an anesthesia nurse/OR nurse. But a mom directly lied to us about her 12-year-old pre-ENT surgery. We always confirm with the patient and legal guardians all the pre-surgery checkup. Name, age/date of birth, any past medical history, common medication, and medication taken in the last 24 hours, as well as surgery proposed and last time you ate or drank anything. The thing is, in the last item of the checklist, the mom lied. Her answer, no, he didn't eat anything since yesterday. The kid confirmed. Note, it was 4 p.m. Outcome. Surgery went well, no problems. When time comes to remove the tube, the kid starts vomiting tons of rice and beans. When I say tons, I mean at least a kilogram of said food. The kid aspirates part of the food against our best efforts. We aspirate and do everything we can, including a bronchofibroscopy. Everything ends up okay. The kid survived. No further complications and recovered to full health in only 2 days. When confronted about the lie and explaining how her son could have died, the Karen mom said, "What could I do? He was hungry and eats like a bull. Who am I to say he can't?" We all lost our patience and just said, his mom. He could and was close to dying because of this. Even if you can't stop feeding your son or whatever, which is a stupid excuse, but say that for some reason you can't. You just have this urge in you to feed. Sure, whatever. Just tell the doctors, though. This kid was in serious danger because of your stupid cover-up for no reason? Come on. Story 27. I give people anesthetic. It's important to know what drug someone's body is used to so we can tailor an anesthetic. Rarely, IV drug users deny taking drugs, even when they're having surgery for an abscess due to a skin infection from injecting. It's on them. They're at higher risk of being aware under surgery if they're ice addicts or not having any pain relief if opioid addicts. It becomes readily apparent once truckloads of opioids don't work. Funnily enough, no one in 5 years has ever admitted to being addicted to coke. Most opioid/ice addicts are fairly open with their drug use. My favorite was a guy that denied any ket use. It was pretty apparent after 600 milligrams or 3 to 6 times a standard induction dose, as he was merrily chatting away to us, relocated his tibial and fibula fracture while he was telling a story. Story 28. Their identity. Insurance fraud using a friend/relative's insurance card. As a resident in a very large East Coast hospital, I was tasked to figure things out when the blood bank called and said their blood type changed. When confronted with getting the wrong blood that may murder them, they almost always tell the truth. This type of fraud has also resulted in people who have been dead and autopsied, raising from the dead, and appearing in a clinic or ER. Story 29. Sort of the opposite, but I have an ankle that I've sprained quite badly twice. After years of PT, I managed to rehab it back to full strength, but I never recovered full range of motion. It's close, though. Years later, I was playing football in the snow with a bunch of teenagers. One of them tackled me and it went the other way, opposite of the prior sprains, and broke. I hobbled back to the cabin and went to the ER the next day. They referred me to a specialist a week later. I gave this guy dates and times for the previous injuries and the one I had at the time. I was as specific as possible and he went all Dr. House on me. Told me he didn't have time to be lied to and stormed out. It was freaking weird. I got in to see another specialist, gave him my history, he helped me build it back, and after another year of PT, it's as strong as ever. Still about 90% range of motion. I'll never understand why that first doc was so sure I was lying. I imagine it was because of the buildup of scar tissue and bone. Even now, it's visibly larger than my other ankle. Story 30. Retired paramedic here. The dumbest thing I saw patients lie about and think we'd fall for? That's tough. It'd either be the unconscious fakers or the drug seekers. The way to quickly check if a patient is conscious or not is I touched my gloved finger to their eye. If you blink, I gotcha. That's when I'd get down on the floor and say, I know you're faking. Here's what we're gonna do. I'm gonna help you up and you're gonna get up. Act your age and stop freaking your family out. The seekers were always, I'm allergic to most painkillers, but I'm not allergic to the, loaded stuff. Straight to triage you go. Story 31. In the ER, 4 a.m. Teenage girl and her parents arrive. She's been constipated for days and no poop has come out at all. I was busy, so I asked the nurse to check if the patient indeed has poop and needs an enema. So a rectal exam is needed. A few minutes later, the nurse urgently called me. When we uncovered the girl, she had tons of clothes. We just saw this cute little head popping out. A baby on the way. Why didn't you tell us that you were pregnant? I asked. I'm not pregnant, she kept saying while I was cutting the umbilical cord. She lied to her parents, don't know how to this day, the whole pregnancy. She lived with them. I had to explain everything to the parents. They didn't have a clue, and judging by their faces, I believed them. While a bit of a horrifying situation, impressive to hide a pregnancy from your parents who you live with for 9 months. Still, I hope that the kid turns out all right. It's a weird situation they're entering into. Story 32. A 13-year-old girl that went to the ER to have a baby and said she didn't know she was pregnant, and that she didn't bang anyone. Mom was wondering why she was always wearing hoodies. I was like, okay then, keep your secrets, and informed authorities to investigate. Apparently the girl had a boyfriend her age and they were just really frisky. She came back another 2 times to deliver more babies at 17 and 21. Same dad, apparently working his butt off. She then opted for tube ligation, eventually became a nurse. Story 33. I was chasing the dog while vacuuming naked and bumped into the pencil, causing it to go into my bladder. That's the weirdest, intimate lie, but the most common lie is about the volume and types of drugs and alcohol people use. So sick of the shocked Pikachu face when I ask about how much they use instead of if they use it. I genuinely don't care what they use in their own time, but the information is really important. Story 34. Had a patient show up in the ER with a wound to the back of her head. I say, hey, Miss X, what happened? I don't know. I picked up chicken from the gas station and went to bed, and this morning I noticed I was bleeding. I start inspecting the wound. Looks like it tracks pretty far, and there's this strange cotton-like material sticking out that is also tracking too deep to visualize. I press her some more about the circumstances because my ER doc spidey sense is starting to go off. Were you assaulted? Did someone harm you? Were you in a car accident? Did something fall on you? No, I just went to bed. Maybe I got up in the middle of the night to use the bathroom. Finally, I decide to send her through the donut of truth. aka a CT scan, before me and my trusty scalpel start seeing where this trail of mystery cotton leads. The lady had a bullet lodged up against her skull bone. Still don't have an answer to the cotton, but I'm guessing the gun fired through some cloth. When I told her she had a bullet in her head, her response was, "Oh, weird." And then she went back to playing Candy Crush on her phone. Is one of the symptoms of being shot not giving a crap? Because that's the only way I would understand this woman's response. Sorry, you were just told you have a bullet in your head. And you're just like, that's strange. I would ask what's going on up there, but I mean, we know. Story 35. Not me, but my mom used to literally tell my doctors I'm lying about my headache. They would believe her because I was a child and I never really, quote, showed my pain. No screaming or crying, just quietly explaining it hurts. When I was 16, we had to get me to an ER because what started as another headache slowly turned into me passing out randomly and losing the memory of entire weeks over the course of a few months. I wasn't, in fact, lying. I was, and still am, but now treated, suffering from a chronic illness, and it could have ended me if it went undiagnosed and untreated. Story 36. Intimate history. Teenage girl came in for lower abdominal pain. We did the usual history and physical examination. She adamantly denied any intimate contact, history of discharge, and refused pelvic examination. She looked like she was in severe pain, so a decision to operate was made. As she was being wheeled off to the operating room, she finally admitted to intimate contact and consented to a pelvic exam, where we found a silicone dong ring with spikes. She had a pelvic infection and did not need a surgery, just some antibiotics. We're not asking questions to be nosy, we're asking because it's relevant. Story 37. Having spent some time in trauma surgery, all the gangbangers who come in with a bullet wound tracking through their testicles and upper left thigh, they all claim some guy managed to pop them at exactly that specific trajectory. But more likely is these guys are shooting themselves in the balls trying to pull their gun out of the front of their waistband with the safety off, and are too embarrassed to admit it. Story 38. X-ray tech here. Did you follow the doctor's instructions on the prep? Yup. This is for a barium enema. Had one guy where we barely got the bag to flow and to scout. He was literally full of crap. Ascending, transverse, descending, sigmoid, all full. We got about 20 milliliters in. Now here's the problem. After a BE, you're supposed to drink 2 to 3 quarts of water as quickly as possible to flush your system, because of the barium left in you. You don't expel it all when you go to the toilet right after. It can harden and cause real problems. So we had to get a PA that happened to be walking by to, quote, examine the PT and order an enema, which was done elsewhere. Never saw the guy again. We quit doing BEs except in rare situations. Story 39. Former ER nurse. Not a lie, but a very, very vague explanation. I'm taking a brief history on a patient with shortness of breath. I ask about any cardiac conditions. She says, I have a thing in my heart. Despite all kinds of follow-up questions, I couldn't get any answers out of her about what was in her heart. Did you have a surgery or procedure to put something in? Is the, quote, thing something you were born with, like a hole? Are you on any medications for it? Was it a clot? Does that sound familiar? I listen to her heart. No murmurs or clicking of a mechanical valve. I take a look at her chest. No surgical scar or pacemaker battery. I never did find out what was in her heart because my shift ended. It was a fun conversation with the ER physician. So, she says she has something in her heart, and I have no clue what. Have fun. Story 40. Not me, but an anesthetist buddy screening a patient before getting anesthesia. We see that your drug screen came back positive for coke. I don't know how. I don't do drugs. We can't go forward with the anesthesia. We won't know how the anesthetic will react with, coke. Oh, I know. My boyfriend does coke. I kissed him before I came in this morning. That must be how I tested positive. Story 41. In my 11 years of general practice, here are the top few. 1. Alcohol intake. Mostly MVAs and assault cases. 2. Pregnancies. Underaged or attempts to abort, both successful and failed. 3. Medical/surgical history. Mostly in legal cases. 4. Age. Since it is illegal to attend to a minor without the knowledge or permission and presence of an adult parent or guardian. 5. Timing of injuries. In my country, people generally do not seek medical aid unless they fear they might die or not see results from their home remedies, or they may gain legal compensation through accidents or injuries and the delay in getting medical documents processed. 6. Fear of culpability/ignorance. As a recent case, I had a 1-month-old female infant who came in critical to the ER, paraparal cyanosis and in obvious signs of shock, bradycardia, and non-responsive. Resuscitation is successful in less than 15 minutes, and we transfer to a tertiary level facility. Mother claims she breastfed and put the infant down in her bed. Then suddenly, the mom was alerted to a gasping infant bleeding from the upper GI and air passages. Background shows a previous kid, 1 year and 6 months, of the same mother with similar clinical picture with fatal results for said infant. We are awaiting the post-mortem report. That wasn't the half of it. I'm still mad about that baby girl. So if I'm understanding that last story correctly, the mother is poisoning or something these children because it's the second one. Is this some horrible insurance fraud? What's happening? Part of me hopes I'm not understanding it correctly, but I fear that I am. Story 42. High-speed MVA. Unrestrained passenger in the front seat with both feet on dash. Fractured her pelvis pretty badly. Consult from orthopedics to identify an odd structure in the region of the soft tissue of the kitty before they try to fix the pelvis. Patient adamantly denies anything is in there. Finally consents to an exam when she's starting to decompensate from a slowly expanding hematoma. Performed under anesthesia in OR. It was a roll of cash in a baggie the size of a Campbell's soup can. Story 43. Once had a patient lie about an overdose. That's not terribly uncommon. In fact, it's more common than not. But the lie was so beyond comprehension it stuck in my head for a decade. He proposed that he never uses H. He was sleeping on a friend's couch and the friend wanted to play a funny prank. So the friend had injected him with H as a fun prank. But because he never uses it, he instantly overdosed. There are a lot of holes in that story, but he really dug his heels in and swore it was true. Turns out really wasn't that funny of a prank. My advice was to find new friends. Story 44. Veterinarian here. If your dog ate drugs, just tell me. I'm not going to call the cops. I'm flabbergasted by the number of people who will swear up and down that their dog couldn't possibly have gotten to any marijuana, when the dog in question is obviously stoned out of his mind. It's frustrating because if the owners are insisting the dog couldn't have gotten any marijuana, I can't in good conscience not recommend a full workup with a bunch of expensive lab work and treatments, when what a stoned dog really needs is to be left in peace in a dark, quiet place with some food and water to sleep it off. Story 45. Had a friend who was an EMT driver tell me about a call she responded to. The guy was barely coherent or audible in his 911 call, but managed to get two pieces of information out perfectly. His address and the word stomach. When they arrived, the man was covered in a blanket, sweating profusely, though he looked like he hadn't moved in days. My friend said she immediately observed that even with early signs of his skin showing jaundice symptoms, his cheeks remained rosy red, and he avoided eye contact and answering any questions. The only words he would speak between groans were poison and stomach. My friend took a quick look around to see if there were chemical bottles out, but didn't see anything. Just as she was returning to the ambulance, she noticed there was a large pot on the stove that had a low flame on it. She turned the range off and removed the lid of the pot and was startled to see a dozen naked Barbie dolls, all of which had their heads removed. When she informed the man that she had turned off the range, he became erratic and aggressive until he was dropped off at the ER. Later in the day, she ran into a friend that worked in radiology, who told her that the entire time the man only answered the word poison as to what he ingested. When they told him they would need to x-ray him, his demeanor completely changed. Calmer, communicated clearer, but accepting the truth that was around the corner. X-ray results showed he had ingested 18 Barbie doll heads, and they were locked up in his stomach for nearly 2 weeks. He explained he sterilized the Barbies in hot water and that they were the newer plastic because the older material was caustic to internal organs. The surgeon apparently ended the conversation by asking him why he would ingest the Barbie doll heads, and the man replied, because he likes the way it feels when he craps them out. Story 46. I had a patient who cheated on her husband, then bought misoprostol/cytotec online from another country to abort the illegitimate fetus. Of course, that didn't exactly go smoothly, so she came to the ED hemorrhaging with an incomplete abortion. She told her husband it was their child and she hadn't told him yet that she was pregnant. He was absolutely devastated. I really felt for that guy. Story 47. Made me think of a funny story. Wasn't a lie, but the truth. In my 20s, I ran with this party crowd. We partied pretty hard on a Saturday night, and everybody crashed at our friend's apartment. We got up on Sunday morning and popped some beers and passed around a joint. Somebody had some leftover blow, so we all did a few lines. One friend started having heart palpitations and asked me to drive them to the ER. When we got in to see the doctor, he asked what was going on. My friend told him about the beers and weed and blow. The doctor gave him the shocked look, and my friend just said, just a normal Sunday morning. I had to laugh. Story 48. I had a patient that came in because he was peeing blood with a previous history of bladder cancer. I ordered a urine sample and told the patient I would start working him up after confirmation. The lab called and told me the urine sample looked like straight up water and was cold as if he just opened the tap and filled it up. I called the patient dumbfounded, and at first he denied it, but later came clean and said he couldn't urinate, so he filled it with water. No clear reasoning why. Long story short, he had cancer. I wanted to laugh until OP gut punched us with that last sentence. Yikes, man. But also, why didn't he just say, I can't pee, sorry, and instead filled it up with water? I just don't understand at all the thought process here. Story 49. Years ago, 2 firemen that were injured on the job were admitted to our unit. Both shared a room since we didn't have private rooms, 2 patients per room, and they wanted to be together. The firemen thought they would play a trick on the nurse, so they switched beds and went by the other's name. The nurse was doing the vitals, assessment, and starting an IV on the one fireman and documenting it into the chart. She was ready to administer the medications and looked down at his hospital band, realizing it wasn't the correct fireman. He was going to take it, too. Both firemen smirking like school kids. The nurse was mad, calling them idiots and beginning to lecture them on their child's game. The fireman was going to take the other patient's blood pressure meds when he doesn't have a history of high blood pressure. Story 50. I had a patient in the hospital who wasn't taking any of her meds at home but kept picking them up and paying for them so that her PCP would think she was. I know her PCP and know that they wouldn't have been a jerk about it. We talked about how we would rather know she doesn't want to take the meds and see what other options we have, if any. Or at least go through which meds are a must and which can be passed on. Also, don't waste your money on meds you're not going to take. That's not good for your health either. Story 51. I have one right now. 60-year-old male hospitalized for an infection following a spinal infusion. He had surgery to remove the infected hardware, and has a cervical collar, neck brace to stabilize his spine, and a treatment plan that says to keep it on 24/7 for 4 weeks. It's been 16 days and he removed it Sunday night. When confronted, he told me that he had cleared it with his surgeon, and told them he had removed it. He hadn't. I explained that he has an extremely unstable spine and the wrong move could result in irreversible quadriplegia, to which he responded, "I don't think that's gonna happen. Even if there's an explosion, I'll hold real still." On the phone with his sister shouting into the speaker, he said, "Well, I took it off because it was so uncomfortable. At first my neck was real stiff, but I shook my head a few times and something in there broke loose. It feels much better now." While his nurse and I stared at each other in silent horror. Story 52. Can I just say, though, please be sensitive to whether someone might be lying because they're abused. When I was a kid, my cheap plastic glasses broke. I pushed them up my nose, frame broke, lens popped out. During Schindler's List, in English class at school. My mom was abusive, so I tried to superglue the frame together first before telling her. Didn't work. Went a few days without wearing the glasses and got headaches. One day I tell her they broke, but I didn't want to say I tried to fix them. However, Detective Columbo himself was working at Vision World when we got there. "Oh, is this some super glue residue I see?" Like, if the vibe is weird, please try to help the person who might be getting beaten over this, you know? Or separate them or something so the scared person can ask for help anything. Story 53. I used to work in physical therapy. An extremely sedentary patient in her mid-50s who had a body type out of a Tim Burton film. Think like an apple on 2 toothpicks. She told me that when she was in the military in her 20s, she was the strongest person on her post. She said she could bench press 500 pounds, and said she was 135 pounds when she could do this. After I told her the bench press record for that weight class for women was 300, which is incredibly impressive, I offered that maybe she forgot and was thinking 225 or 250, which would still be incredible. Nope, she doubled down. She proceeded to tell me that she could leg press 900 pounds and overhead press 2 men sitting on a 2x4. For the record, this lady didn't even know how to perform a body weight squat in a pool with correct form. Story 54. Phlebotomy technician here. If you are on blood thinners, you need to say so! Don't lie about it or you will bleed badly. Seriously, the baby aspirin you take is a blood thinner, and I would rather have extra gauze on you than blood on your clothes and my floor. Also, don't lie about fasting. Your lipids or blood sugar will just tell the truth. If you had a coffee or something, as long as it's just black coffee, we don't care. Same with plain tea. Also, when I ask if you drank water yesterday, it's so I can gauge how hydrated you are. Don't lie, please. Story 55. Surgical nurse here. It's always the little things that are just so stupid. Lying to your anesthesia team about smoking. A. It affects your reaction to intubation and can make it difficult or dangerous unexpectedly. B. In non-emergencies, any pre-op chest x-ray will tell them anyway. C. Once they do intubate you, they will know. Lying about fasting before surgery. Your stomach needs to be emptied, so when we put a tube in to hold your airway open, the contents of your stomach don't attempt to murder you by going up into your lungs. It's not to be mean. You won't die for not eating for 1 day. We require it because it's best for you, which is all we ever want. Story 56. I've had over 60 procedures/surgeries on my legs in the last 4 years. They don't usually give me anesthesia, but they give me Versed and Fent to knock me out. I've eventually gotten immune to that with me going into surgeries sometimes 3 times a week, so I would eventually wake up in the middle of them working on my legs. I don't remember much except one time when I woke up and was in complete shock while watching them. Then I started crying because the pain was too much. My surgeon knocked me out immediately after that. I still wake up during procedures. Thank God I've had the same surgeon, as he knows I'm not a drug addict, and don't need more medicine because of that. I'm literally just disabled at 25. I think there was a comment recently telling me that what I pronounced as versed was versed, so hey, that came up here. Thank you. That aside though, 60 procedures in 4 years sounds almost torturous. OP, I'm wishing the best for you and your condition, whatever it may be. Story 57. Not really a lie, but an unintentional absence of the full truth that resulted in a medicological dilemma. Trans woman came in for unrelated colon surgery. Nowhere in her record was there any mention of her transition. Our entire team was under the impression she was a biological woman. She received anesthesia and the team began undressing her when suddenly I hear, Doc, I think you should see this. I come around the table to see the woman's legs wide open in stirrups and a dong between her legs. Although the whole team had just spoken with her previously, we now had a medicological dilemma. The surgery had to be paused as technically we had a patient on the table that was different from what we had expected, and could no longer confirm with the patient her identity. This type of issue is rare, but variations have happened a few more times since then in my career. We need a better method for patients to document their medical history beyond the question of simply sex, M or F. Story 58. My mom lies to doctors all the time about the stupidest things, like how much she exercises, how much help she requires at home. She lies and says she can move around fine on her own, even though it's not uncommon for me to have to help her to the bathroom, supporting her the whole way, even having to outright carry her a couple times because the halls are too small for a wheelchair, because she doesn't want to be chewed out for her poor decisions. For example, the most frustrating and repeated lie, she's just been diagnosed with cancer, needs stents in her heart and renal arteries because they're barely getting blood into them, and her kidney function is dropping scarily low. For the many doctors in this thread, her GFR was 27 last time we had it tested, and she needs surgery to remove the tumors in her abdomen. The problem? She currently weighs 67 pounds, and the doctors refuse to perform surgery on her, and the anesthesiologists, so far we've been through 7, all adamantly refuse to put her under until her weight is high enough. She barely eats but lies to her doctors about how she's eating a bunch, and she doesn't know why she's not gaining weight. It's not uncommon for her to eat less than a single bun with some lunch meat on it in a 3 or 4 day period. She insists to us, her family, that she's eating plenty and she'll gain weight. As her full-time caregiver, I've tried to explain to her that she simply will not gain any weight until she's out of a calorie deficit for a sustained period of time, and that is just basic biology, but she refuses to accept that, and will either outright deny she's not eating enough, or will get so abusive that it makes anyone in the family trying to talk to her about it back off, because they don't want to deal with the mental abuse. Story 59. Paramedic here. The most common one? Oh, have you had any drugs or alcohol today? And they will always say no. While me and my partner count the 6 bottles of rum, 2 Mickeys of Fireball, 12 beer cans, 3 wine bottles, and an open vodka bottle in the patient's home. Meanwhile, the patient is currently sipping on a beverage that smells suspiciously like vodka cran. Story 60. Paramedic, but this is a good one. We got called for, quote, a man running down the street covered in blood. While waiting to see if the cops found him, an off-duty cop stopped us and said he was looking for a guy who was breaking into an RV storage lot. Said he pumped 2 rounds of birdshot after him as he ran away. Nobody was found, so we headed back to station. 5 hours later, we were called to a man who said he was in a car accident and had 80 pieces of birdshot in his back and legs. Hold on. This is pretty unrelated to the thread, but does this say that the officer fired at someone who was trying to break into something while they were running away? I'm not super familiar with what birdshot is. Maybe it's non-lethal and fine, but I don't know. This seems like an inappropriate use of force to me, but maybe I'm wrong. Story 61. I feel for you guys so much. My dad exploded a part of his intestine a couple years ago by an errant chunk of wood that hit him in the stomach after it shot off his table saw. He had emergency surgery and had to go back in several times to go handle the fallout from that. It's miserable. I went to visit him one day and he asked me to hit the nurse button quick and to please leave. As I walked out, I caught a glimpse of his vomit literally hitting the ceiling and wall. You guys deal with the worst of the worst, but seriously, God bless you for the work you do. My dad is one of the kindest, best, most wholesome people on earth, and it shook me to see him almost wanting to take his own life with what he was dealing with. But his nurses were incredible and I appreciate them so much. It's not glamorous, but it makes such an incredible difference in people's lives. Story 62. 1. A patient arrived with a bandage on his head saying he'd fallen from his bed and injured it. After an hour in the waiting room and after removing the bandage, I could see part of his brain. Dude was in debt with drug dealers and was dragged through a highway tied to a car. 2. A middle-aged man who lied about not taking Viagra during a heart attack. This is a big problem because the medication we use may interact with the blue pill and worsen the condition, a high price to pay in order to defend some dumb idea of masculinity. Story 63. I'm an ER doc, and I've heard literally so many lies I've probably permanently forgotten thousands of them. Recently, I saw a lady who was obviously pretending to be nauseous, and she was carrying a napkin folded around something. She claimed to have just vomited it up. She swore it was nothing she'd eaten. To me, it looked like some kind of caterpillar / butterfly pupa / larva or something like that. I touched it and it felt sort of like a worm, but was a weird gray off-white color. I sent it to be analyzed by pathology and they reported it back as being a rubber or latex worm, likely a fishing lure. I'm still not quite sure what her motivation was, aside from possibly just doing it for attention. Story 64. Worked for a general practitioner, taking phone calls and scheduling appointments. I was the one who had to ask why a patient needed an appointment. Had a patient claim severe abdominal pain, so that's what I wrote as a reason for a visit. Turned out the pain was caused by a rodent in his butt. Got scolded by my boss for listing abdominal pain as the reason for the visit. Had another patient need a visit for what she was insisting was female troubles. Refused to be more specific over the phone. She had a carrot lodged in her that got stuck after John paid extra to see her use it. Story 65. Cannabis hyperemesis. 16-year-old girl, looked to be 16 going on 47. Very theatrical about the whole presentation. Has apparently had, quote, 2 years of vomiting and abdominal pain, and she's fed up with the system because they can't figure out what's wrong with her. But equally very defensive when asked about drug use. Your diagnosis is only as good as the history you provide. Vehemently denied drug use. Her UDS came back positive for THC. She discharged against medical advice and was verbally aggressive the whole time. Story 66. Whilst rare, hiding symptoms to see if I can get the diagnosis correct, or some alteration of this game which in their judgment determines if you're a good doctor. I see the smile on their face when it coincides with what is happening, but I get frustrated because it took me 40 minutes to extract that information through questioning, during which they hid crucial info. Another doctor would have long ago concluded the wrong diagnosis and the outcome would be at best ineffective and worst lead to death, sooner or later depending on the issue. Story 67. Nurse here, not doctor or surgeon, but worked in surgical service line, pre-peri-post, for several years. Background info. Ice and coke in the system screws with anesthesia in a life-threatening way. These are pretty common recreational drugs, so to make sure we don't have dozens of people dying on the operating table every year, we ask every pre-op patient as a standard screening question when they're getting prepped, and include the info about it in the pre-op clinic paperwork. Well, this guy must have missed the question in clinic or on his day before surgery confirmation call. He feigned outrage upon being asked this standard question. Tried to explain it to him, no dice. He called me and the CNA who was with me a slew of mean-spirited names, claimed he was being racially profiled, he was white and I am white, demanded to speak to the CEO. We aren't a private hospital, that's not even the title we use for our main executives, but all the same. It took a supervisor, a chief nurse, and a surgical attending to finally calm him down. He had missed his appointment window and was bumped. We got him into a bed and he rested for a bit. Had a chat with one of the surgeons about a hunch I had. Despite potentially getting this guy to flip out again, she backed me up and got him to agree to a talk screen. Guess who came back positive for ice? So yeah, dumbest thing a patient could lie about, whether or not they did a thing that would murder them. This guy wanted to sue the hospital for being asked a screening question that we ask to everyone to prevent potentially fatal reactions. After asking about it and being told exactly what the outcome would be, he still lied anyway, and only survived because he decided to throw a freaking fit in the prep room, and missed the appointment that would have ended him. Dumb ways to die. I don't remember this one from the song. I think it would require a few too many words. Story 68. Pretty recent. A patient came into the lab for a KOH and culture for his, quote, bumps, which were itchy around his inner thigh. We collected his KOH, fungal test, and culture, bacterial, as his dermatologist wanted to figure out what was wrong. We're in a pretty big international hospital down in Southeast Asia, so we get all kinds of consults, including those who can pay for stuff that they don't need and coerce doctors into prescribing. This particular patient didn't actually have bumps, but his legs were hella hairy, and you could tell he had bad personal hygiene, so we figured he was a hypochondriac. Nothing pointed to bugs, too. He was hysterical with the receptionists and doctors who spoke to him. His KOH came back negative and he started harassing and chasing people at the lab by pulling his pants up and showing his itchy inner thighs. Patients, supervisors, and doctors alike When we told him we collected the samples already and it was his doctor that was going to prescribe meds, he did Dr. Google on himself and tried to make us collect more for his pending culture. Doesn't work that way. We outright refused. So he disappeared for a few minutes and he came back with wounds all over his inner thighs, telling us we missed it and it was our fault. They were clearly scratch marks he inflicted on himself for attention as he was making a scene. The saga isn't over. He barged into the laboratory demanding his positive results for his bacterial culture, as he insisted the lab could prescribe him antibiotics. Basically, there's an angry Southeast Asian man with hairy legs harassing people. And before anyone says, "Oh, why doesn't security do anything?" Our hospital is so afraid of a PR fiasco, they basically let the crazies do anything, including harassment. Story 69. Absolutely everything, man. Just everything. Nobody snuck ice into your breakfast tea. No, you're not taking your medications as prescribed if you can't name a single one of them. No, you're not drinking a beer or two a day when you're sitting here in full-blown withdrawal. A personal favorite of mine. You all do realize I can look up controlled prescriptions written for you, right? I can tell how much oxycodone or morphine or whatever you're prescribed. Don't even try it. This, "Oh yeah, I take 30 milligrams 4 times a day" nonsense. No, you don't. That got discontinued 2 years ago. Story 70. I lied to an ER doc about how I cut my wrist. I was 17 and wanted to take my own life. Thought slitting my wrists was the answer. I did one long, straight, deep cut and immediately thought this was a mistake. Told some very elaborate story about how I had just sharpened a knife and it slipped when I was trying to cut an apple. I don't think he bought the story. Just sewed me up and sent me on my way. Parents didn't probe on it either. Decades later, I'm still angry and hurt no one tried to help me. I was clearly crying out for it. Story 71. A 6-year-old girl arrived to the rural hospital I was in because of shortness of breath. As it was mid-2021, we were thinking it could be COVID. So after the first assessment and stabilization, a chest x-ray was taken. She had a 50-cent Mexican coin in her airway. When we asked the mother, she completely denied the fact that she had swallowed a coin, despite the fact we're showing her the x-ray. After a while, the granddad of the girl arrived and finally told us she had indeed swallowed a coin, but it was 6 months ago. In the end, they didn't bother to check what had happened to it. I feel the need to say the whole, Mexican coin thing, it's written in the story. I didn't just change peso to Mexican coin. That's what they said, so don't come after me. Story 72. I have a friend who I took to the ER because he was upset a girl he liked rejected him. He was a little drunk and we were at a party. He punched the brick wall in the basement and gashed his hand open. I was surprised he didn't break anything. Anyway, because he was drunk and I wasn't, I drove him. I figured it would be an uninteresting visit, but then he straight up lied to the ER nurses about his hand, saying he got into a fight and he cut his knuckles open on the teeth of the other guy. I just shook my head with disbelief, and they explained to him how he would need antibiotics now. Story 73. I was in med school. Elderly patient was admitted to the hospital medicine ward. She had these pressure ulcers/sores on her skin, which develop in people who are bedridden and can't move on their own. So the skin gets sandwiched between the mattress and their own bones, causing ulceration, but that takes a long time. And her daughter, adult woman, tried to convince me those sores developed because her mother had been waiting for a couple hours in the ER until everything was ready for her hospital bed. A few days later, I listened in on her, the daughter, talking to the head of medicine and the doctor in charge of her mother's case about treatment options and whatnot. The following morning, I do my rounds, and when asking about the patient, this woman goes, "The other doctors told me there was nothing to do for her." And I was like, "No, lady, they told you exactly what they were going to do for her." But since I was the student, I had to keep quiet and nod. Story 74. I fell in the shower and that's how the shampoo bottle went up my butt. I'm not sure how this pencil got up my urethra. I was sleeping. No, of course I didn't eat anything this morning. I was told not to, so I didn't. I'm not sure why I was shot. I was just out trying to sell some Bibles. No, they never gave me my pain pills. Of course I don't drink. I haven't had a drink in 3 years. I'm definitely not pregnant. No chance of that at all, actually. Story 75. We have a patient who comes in sporadically with the different aliases claiming she has sickle cell disease and faking stroke-like symptoms. We activate a stroke alert because she's in the TPA window, but she refuses to go up to CT until given multiple doses of IV dilaudid. Always a mess because with the different aliases, it's difficult to keep track unless one of the MDs or RNs recognizes her from a prior visit. She frequently leaves AMA after the TPA and dilaudid pushes. My city is going to have a TPA epidemic on its hands soon. Story 76. I've only ever lied to my doctor about things that, while problematic to me, are innocuous and things I won't die from. Best example is that I'm on Zoloft and Wellbutrin for anxiety, and I now sweat like crazy and my libido has dropped way off. I let them know about the sweating because truly it's annoying and uncomfortable, but the lack of the drive, it's fine. Even though I'm 29 and have been in a long-term relationship for nearly 9 years, I always feel like my doctor is judging me and or thinks any concerns I have about drive aren't legitimate. Even though it's part of wellness and psychology, I feel like in the context of it being taken away by an antidepressant, doctors are generally like, you sad? You chill? You feel more balanced mood-wise? Then shut the hell up and take the good with the bad. You can't finish in bed, but are you calm? Did you die? Yeah, I thought so. Story 77. 13-year-old kid told me that he didn't know how the Mardi Gras beads that were lodged in his urethra got there. Also, people who come in with penile fractures interestingly always tell a lie like, I hit it on the edge of the table as I was falling. Sir, I don't care if you were banging and she landed the wrong way. I just want to fix you up, and I need the right info. Story 78. A Mormon nurse I know that used to work ER in Utah told me these stories, beginning with, you wouldn't believe how many guys came in for things that were stuck in their rectum. Guy comes in reporting abdominal pain. They do some kind of scan and found a glass bottle. Doctor tells patient the news and he says, oh my, that's so bizarre. Someone must have broken into my house and shoved that in there while I was asleep. And another one where the story starts the same except doctor finds a potato instead. Doctor asks the patient about it who says, I fell. So doctor replies with, then why is there lube on it? Story 79. Years ago, a patient was hospitalized in the psychiatric department for alcohol abuse. Obviously, alcohol is prohibited in the department, but family is allowed and they can even bring little gifts. For example, this patient's wife brought him fresh oranges each morning. Days in the hospital and he was still showing signs of alcohol abuse. A test confirmed he still had alcohol in his blood. He told me it's his stomach that produces alcohol. We found out his wife filled the oranges with vodka using a small syringe. Each morning he squeezed himself a fresh vodka orange. I still use this story to show students how the social environment can be part of the problem. Hey man, I like a good screwdriver as much as the next guy. At least that was until one night where I had too many of them and threw up. Anyway, but in the hospital? Probably shouldn't be indulging, my friend. Story 80. I've worked at a community outreach clinic for some FMCH rounds. I've had a patient come in and explain their whole family for the genogram I was supposed to make. They come back the following week with their mother. Turned out they made up the majority of their genogram family, and especially their wife and children. They lived alone with their parents still. It was weird and I had to fix the paperwork, but it also kind of made me sad, because I remember how excited he was explaining his wife and kids. All when they didn't even exist. Dude was about my age, too, a little younger. Story 81. Had a guy call as he was using a fake dong on himself and it got sucked in. He called us out. When we got to the house, we could still hear it running. We asked how long it had been in there and he replied, the whole 9 inches. Not technically a lie, but a funny story. Another gentleman called us out for a ketchup bottle in his bum. He said his, quote, doorstep was wet and slippery, and as I put my groceries down to get my keys out, I slipped and fell on the bottle. Miraculously, his jeans didn't rip. I must have phased through. And one gent called us as he had his junk stuck in a curtain ring. Used it as a dong ring, I imagine. Said it must have fallen off the curtain pole onto his bed, and he rolled onto it. This was 3 days later, and his dong was massively swollen. Man, I've heard loads of great explanations for things. I didn't keep a running tally, but I think 20+% of the posts here were all about dong-related stuff. Come on, guys. Just tell the truth. If you add all the stuff stuck up people's butts, I think that takes us to a clean 50%. Maybe more. Anyway, in summary, doctors are there to help you, and they can't help you properly unless you tell them everything. Everything they need to know, at least. So please, just tell the truth to your doctors. They want to help. You will not be shamed, and if you do get shamed, that's just a crappy doctor. That's not your fault. Anyway, thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.